Well, there is a house in this old town where my true love lays around, down upon another man's knee, and tells him little tales she won't tell me. And it's hard, ain't it hard, ain't it hard to love one who never did love you. It's hard, and it's hard, ain't it hard, great God, to love one who never will be true. Well, the first time I saw my true love, she was passing by my door. And the last time I saw her false hearted smile, she was dead on her cooling board. And it's hard, and it's hard, ain't it hard to love one who never did love you. Oh, it's hard, and it's hard, and it's hard, great God, to love one who never will be true. Well, don't go a-drinking and a-gambling. Don't go there, your soul's fall to drown. For that hard liquor place is a low down disgrace. It's the meanest damn place in this town. It's hard, and it's hard, ain't it hard to love one who never did love you. It's hard, and it's hard, ain't it hard, great God, to love one who never will be true. Now who's gonna kiss your red ruby lips, and who's gonna hold you to their breast, and who's gonna talk the future over with you when I'm out a-rambling in the West? Oh, it's hard, and it's hard, ain't it hard to love one who never did love you. Oh, hard, and it's hard, ain't it hard, God, love one who never will be true. Yes, it's hard, and it's hard, and it's hard to love one who never did love you. It's hard, and it's hard, and it's hard, great God, to love one who never will be true. To love one who never will be true. Thank you.
Well, ladies and gentlemen, welcome to this Huntington's Australian National Conference 2021. My name's Julie McCrossan, and it's my pleasure to be your MC today for this webinar that is going to be looking particularly at issues about policy to improve the lives of people living with Huntington's and their families. Just before we begin, I want to acknowledge that I'm broadcasting to you today on Aboriginal land, the land of the Gadigal people, and I'd like to pay my respects to elders past and present. And Lewis Kaplan, the Chief Executive Officer of Huntington's New South Wales ACT, is also broadcasting on Gadigal land as well. He's played obviously a crucial role in the development of this series of webinars to make up the conference, and he's running our technology today. And that marvellous music we've been listening to is Bruce Hearn paying a tribute to Woody Guthrie. And as you may know, Woody Guthrie, the famous American folk singer, lived with Huntington's disease, and his second wife played a fundamental role, a foundational role in the establishment of Huntington's Disease Society of America. And Woody Guthrie, of course, was a huge influence on Bob Dylan and so many others. And we celebrated Bob Dylan's 80th birthday during the time of this conference. As I said, our theme today is policy. And this is being recorded, and you will receive, if you've registered for the conference, a link to the recordings of all 4 webinars, and they will be available. There'll be a link to them on the Huntington's New South Wales ACT website. So welcome again as people join us to this Australian National Conference 2021. Thank you to our sponsor Roche and to our supporter, the Australian Government's National Disability Conference Initiative, and also to our exhibitor, Novacor, who are producers of specialist chairs and beds for people living with Huntington's, and we saw some examples of them at our first webinar. Some quick housekeeping before we come to the first of our 3 speakers. We will have each speaker for 30 minutes, and that will be followed by an opportunity for some questions and discussion. And you can put your questions in the Q&A just by clicking down the bottom on Q&A all the way through. And the only way that your questions can come through to the panel is through me, because we can't see or hear you. So, ladies and gentlemen, it gives me great pleasure now to welcome our first speaker, Alistair Hoare, the CEO of Scottish Huntington's Association. This is a pre-recorded session because there is an extraordinary time difference between here and Scotland. But Alistair Hoare is going to give us insights into the Scottish approach. It's very holistic. They have a multitude of ways that they're supporting people living with Huntington's and their family, including a national care framework. So using deaf sign clapping, let's welcome Alistair Hoare.
My name's Alistair Hoare. I'm the Chief Executive of Scottish Huntington's Association. I'm very grateful for the invite and to have been given the opportunity to come along and speak to your conference about the National Care Framework for Huntington's disease and the impact that it's had on people's lives in Scotland. So without any further ado, I shall endeavour to get my slides up and talk you through the background to the work that we have done and the impact that it has had so far on people's lives. So as I've said, my name's Alistair Hoare, the Chief Executive of SHA, but prior to becoming the Chief Executive of SHA, I worked as the National Care Framework Lead for Scottish Huntington's Association, and that is perhaps one of the reasons that I've been invited to come along and speak about this topic today. Now, as it is an Australian conference, I thought it would be important to make sure I highlight my Australian connections to get a rapport with those who are listening today. And I do actually, I'm pleased to say, have an Australian connection, and that is I have an aunt and uncle who live in Hobart in Tasmania. And I had the great pleasure of visiting Hobart and the whole island of Tasmania, which I understand to some is known as the South Island, some years ago, perhaps 15 years ago. And there was some beautiful scenery there, and we had a great time. And this, of course, is Wineglass Bay, as I recall, and we had great pleasure visiting that particular beach. But one of the things I do recall about being in Australia generally, both the North and the South Island, as I came to call it, was some difficulties in being understood. And this also, I must say, went both ways. And often you would approach someone to speak about some topic or other, or where you can find some food, or where you can get a beer or anything of that nature. And quite often there'd be a rather confused look at first, and then you maybe slow down, and over time the person is able to understand you and a conversation took place. And at the end of that conversation, invariably what was said was, "I'm really sorry, we don't get many Irish accents around here, so I'm sorry I couldn't understand what you were saying at first." So clearly misunderstood to be Irish, and I suppose that might be a bit like someone misunderstanding an Australian accent to be a New Zealand accent, and that's not something that I've ever done or certainly wouldn't admit to in this current context. So anyway, I've put forward my Australian connection, so hopefully you're convinced of that. So before moving on from this, I just want to give a brief summary of the presentation that I have ahead of us. So first of all, I want to say a very brief couple of words about the Scottish healthcare system, and then also feel it's important to give a bit of an introduction to the Scottish Huntington's Association's core services, which of course feed into the development of the National Care Framework. After speaking about that, a little about the local care frameworks that we developed, the reception that we've had for this work, achievements to date, and some closing remarks. So first of all, very briefly on the Scottish healthcare system, and I do mean briefly, clearly Scotland is part of the United Kingdom, and we have a United Kingdom Parliament and a United Kingdom Government, but we also have a Scottish Government and a Scottish Parliament, and the healthcare system in Scotland is entirely devolved to the Scottish Parliament and is controlled by the Scottish Government. And what I'm showing on the screen here just now are the NHS board areas, so kind of regional areas of Scotland, which are divided up into NHS boards. And these are the areas that I'll be speaking about when I come to talk about the localised care frameworks for Huntington's disease. We didn't do the island areas, we focused on the mainland areas. The island areas were connected to Highland, which is one of the mainland areas. So very brief background there to the localised system in Scotland. Then a little bit more introduction about Scottish Huntington's Association and its core services. So we have 3 core services, the first of which are HD specialists, and these are employed by us on a regional basis based upon the map that I've just shown. So for each of the health board areas where we have a service, they are based in that area, however they're employed by us. Now they have a role to assess need, to coordinate care, to train, to educate and to advocate, and they come from a variety of backgrounds such as nursing, occupational therapy and social work. The second core service that Scottish Huntington's Association has is specialist youth advisors, and they're employed again by us, but this time on a national basis, not attached to any particular health board area. They provide one-to-one support, they provide group sessions, activity days, residential breaks, and they, when COVID allows, they do a 5-day summer camp for children and young people living within an HD family. And the third core service is our financial wellbeing service, which again is a national service, and the staff that we employ help people with welfare benefits, debt, bank accounts, mortgages, insurance, pensions and energy advice, a whole range of money issues they assist HD families with. And this final slide are not employed by us, but these are doctors, consultants that are employed by the NHS in the regional health boards that I showed the slides for previously. Now they are generally psychiatrists, geneticists, neurologists, and we have a neuropsychologist who is a lead clinician for Huntington's disease. And all of our services that I have mentioned in the slides prior to this work very, very closely with the HD clinical leads to help HD families throughout their treatment and support journey. So those are the 4 services that are required as part of the framework and which existed before the framework, but which the framework sought to ensure was more widely implemented throughout Scotland, as we'll come to see. So I suppose the first question might be, why would you bother developing a national care framework? You've got your HD specialist, you've got your youth advisors, you've got your financial wellbeing service, and there are HD clinical leads. You're in a very fortunate position. Why develop a care framework? Well, these are some of the reasons why we would do that. There's significant variation across Scotland in terms of these services. Some have great services, some areas have no services at all. So as a result of that, there's poor understanding. Where there is support, it's not always joined up. It's regarded as a low priority to in regards to other conditions. And also HD by some is regarded as a specialism orphan, in the sense that there's a lot of people who believe that, well, HD, that's just a neurological condition that can go on with general services and that will be fine. But of course, we know that's not the case. And so these are some of the reasons why we sought to develop a national care framework to deliver more joined up health and social care, to deliver a single national model, which would be localised to each region, to give clearer ownership of HD, increased profile, priority and engagement, and greater consistency in quality of care throughout the country. So what we wanted to do in developing this care framework and deciding that this is the route we wish to follow, we thought it was hugely important that the framework was not developed by us in our head office or by speaking to one or two staff. It had to be developed by everyone who would be needed to implement the framework. And that is why we set about developing a national care framework development group, which included people from all the various backgrounds that I've highlighted on this slide. We had spoken to other organisations who sought to develop frameworks for other conditions, and a very strong piece of feedback was that it was hugely important to have those involved from the outset that you wanted to be implementing the framework at the end. They had made that mistake, and we were determined not to make that same mistake by trying to do it ourselves without having all the right people round the table from the outset. So that's what we did. You can look on our website and you can see who they were. It was a very substantive group of people, substantial, should I say, and we're not fitted on a slide. So look at that and you'll see the support that we got. Now, the care framework group sought about, first of all, establishing what is the point of this framework? What's it seeking to do? Well, first of all, it's seeking to help to promote good practice in order to educate and inform health and social care providers and staff who are less experienced in HD. It seeks to empower HD families by making clear the sort of care and support they should expect to receive wherever they are throughout the country. And as a result of putting these two things together, it will help to minimise the regional variations in care and support by highlighting and sharing good practice. So very briefly on the timescale of how we achieved this and how we worked towards this, we received funding from the Scottish Government for this towards the end of 2015, and I was appointed to lead on the work in January 2016. By the middle of September 2016, by working with the development group that I'd referred to, we developed a draft text, and then we put it out to a substantial consultation. And we managed to get Scottish Government ministers to assist us by promoting that consultation. And that resulted in over 150 responses throughout Scotland, but indeed beyond the borders of Scotland to various places throughout the world, including Australia and the United States, the Republic of Ireland, and Norway, and various other Scandinavian countries. So it was fantastic to have received such a high level of response. On the back of that, we updated and signed off the text by January 2017. Our web version, which you can hopefully review at your leisure, and I'll provide the details during this presentation for that, went live in February of 2017, and in May of that same year, we had a Scottish Parliament event to formally launch the National Care Framework for Huntington's disease. From that point onwards until January 2020, we worked on localising the care framework to ensure that it fitted to the local context throughout Scotland. So having given a bit of background to the framework, I'm going to seek to show you the framework as best as possible on a PowerPoint presentation. Now, of course, as I've said, it's best to look at the framework yourself on the website, but this hopefully will give you a flavour of it. So this is the landing page of the National Care Framework, and it shows you some of our supporters outside the Scottish Parliament before a lobbying event that we'd previously held. But within this, there are the core concepts of the framework, which are outlined on the landing page. First of all, it gives a bit of background to the framework, but then it talks about the core concepts, and that's those 4 points we see highlighted there. I won't read entirely, but you can see the key points are there needs to be a single named specialist that is the focus of the care, and that the families can approach and get their support from. Round that single named specialist, there needs to be a multidisciplinary team. There needs to be a clearly mapped network of services, and that the specialist staff play a central role in providing education and training to the wider support network. So that's some of the basics that are underpinning the concept of the National Care Framework. Also, before we get into the detail of the framework, we have the guiding principles of the framework, and they are a person-centred approach, a family systems approach, a biopsychosocial model of health and disability, personalisation, and a palliative care approach. Now, these on the website, you click on the box and it'll give you a description of what each of these approaches are and what they mean, and they help to put the foundations to what follows in developing and making sense of the National Care Framework. Without those in place, the National Care Framework cannot work. On this slide now, I'm showing all the themes that we established from working with our families and working with our development group and working through the consultation process for everything that an HD family should require at any stage throughout their experience, from cradle to grave. And so I'm going to read them out so that everyone is able to appreciate them if it's not possible to read them. And those key themes are deciding whether to have the genetic test, finding out if you have symptoms of HD, getting help with the symptoms and associated difficulties of HD, getting information and advice about HD and someone to support you, support with employability when you need it, getting financial help when you need it, getting advice about having a family, getting support for children, young people and parents, support if you're a caregiver and getting a break from caring, getting support with day-to-day living and reducing isolation, getting support to adapt your home or live where you choose, support to plan for the future, moving to supported accommodation and long-term care, care at the end of life, getting support out of hours, and participation in research. So those are the key themes that we have listed down the side of the National Care Framework when you click onto that. And of course, it's not meant to be read as a book from start to finish. Yourself, whether you're an HD family member or whether you're a health and social care provider or staff member, you click onto the theme that's relevant to you any given point in time, and you're then presented with this screen, which shows you the examples of support, key services and people, integrated multi-agency arrangements, referral pathways and resources, standards and outcomes. And regardless of which the themes you click on, these are the options that you're provided with. And you click on to see whichever is relevant to you. So I've just given a screenshot here of the key services and people for deciding whether to have the genetic test. It lists who they are. And if it's in light blue, it's a hot link. So it links directly to a site outside the framework for the details. And there are a couple of black ones there which don't have hot links, and that is put right at the localized version, because this is the national version we're looking at just now, and there weren't always the information to link to. So that's the basic principle of the National Care Framework. It gives you all the information you require at any stage. It tells you all the information and support that you should be able to receive, and who to receive it from, and what you should be able to expect throughout that process. So, having developed a National Care Framework, we launched it in the Scottish Parliament. Now, on the left there, that's a picture of myself with Shona Robeson, who was then the Cabinet Secretary for Health in the Scottish Parliament. And she launched the event for us. But also we have, and I won't name them all, because they won't be known to you in any case, I would imagine, most people at this conference, but it is the leader of the Conservative group. And then we also had the leader of the Labour Party in the Scottish Parliament on the left, and the leader of the Green Party on the right of this screen. So we've got cross-party support for the National Care Framework for Huntington's disease at this event. And these stairs would be very famous for people in Scotland, perhaps less so to this audience. These are the stairs in the Scottish Parliament, in the Garden Lobby, where most political interviews take place within the Scottish Parliament. And we have some family members here with the Health Secretary at the launch of the framework. Now, the other thing that was good about the launch of the National Care Framework was that the Scottish Government at that point endorsed our work, formally put their weight behind the National Care Framework, and gave us additional funding to develop regional frameworks for each of the mainland health board areas. Now, It works in exactly the same principle as the National Care Framework, and we have here the list of all the mainland health board areas. What simply happens is you click on the link for wherever you happen to live, and it will then take you to exactly as we saw before, but this time, as you can see, all the links are blue because they're hot links, and that's the links to all the local services in your local area, with the details from the national framework having been updated, localised and tailored to the local situation. How did we do this? Well, similar process to before with the National Care Framework. We developed the same localisation group, same people, same skill sets, but in this case, specific to the local health board area in question. And we used the National Care Framework as a template, and we updated it and we localised it, and we made sure that it worked for families and staff in the local area in question. We then followed this work up by having formal launches to ensure that the work that we had delivered wasn't just sitting on a website somewhere with no one looking at them. We wanted to maximise awareness of them by the launch events. And I'll just quickly flick you through some of the pictures from this. We have media coverage here of the first, which was in Ayrshire and Arran. And that again is the Health Secretary, Shona Robison, who came along and supported our first regional launch. We then launched in Fife, in Grampian, in Lanarkshire, in Lothian, in Greater Glasgow and Clyde, and in Highland. And we also have completed the work in NHS Forth Valley, Tayside and Dumfries and Galloway. All those frameworks are live and online, but we've not yet managed to have a launch event. And the last area in Scotland, in mainland Scotland, is NHS Border, and that's still a work in progress. We're still working on that, and that's the final piece of the jigsaw. So in terms of the reception and how people have regarded the National Care Framework, we've had support, as I've said, from the Scottish Government. As we reached the end of the process, their view increasingly was that not only was this a success for Huntington's disease, but it stood to benefit families impacted by other neurological and long-term conditions if this model was followed, and they seemed hugely encouraged by that. And we were also grateful to hear feedback from charities and organisations working on behalf of other neurological conditions and long-term conditions, such as this example here from the Chief Executive of Revive MS Support, talking about how the framework, again, could potentially be a model for other neurological conditions. And we are aware of other neurological conditions who are seeking to pursue that very course. And of course, we also have international support for the framework for the HD community, and we're aware of other countries who are seeking to follow suit. And we are happy to work with anyone who wishes some assistance in that. And we have here a quote from Astrid Arnason, who's the president of the European Huntington's Association. So to sum up, the National Care Framework, care.hdscotland.org, outlines an integrated care model of care and support. It is flexible because it's a website and it can be altered and updated as systems change and as people change, which they always do. It means that we can update that so it doesn't become obsolete. It is easy to access and use. It's person-centered. It's focused on the needs of the whole family. It's tailored, as we've seen, to fit the local context. And it's measurable to ensure it delivers real change. And it's measurable because at the start of launching each local framework, we did a survey of families and we did a survey of health and social care staff. And those baseline surveys are there to measure against in due course to see to what extent the framework has delivered benefits from the perspective of families and health and social care staff. But nevertheless, we have achievements to date. So you may have looked at this and thought, well, you know, you've got this great website, so you say, and you've got lots of support for it, and you've got lots of great quotes there, but so what? Who cares? Ultimately, it's just a website with information on it. Nevertheless, we would argue that we've delivered significant improvements already at this early stage, simply as a result of developing the national and local care frameworks. So, for example, in Dumfries and Galloway, which is in the south west of Scotland, we had never previously had a lead clinician and we had never previously had an HD specialist, but they are now in place. For the first time, they are in place, and that is perhaps one of the greatest achievements for the framework. And they began at the beginning of this year in their roles, and they're developing local services round about them. In NHS Grampian, one of the local areas within that, Murray, did not have an HD specialist, didn't engage with the HD specialists that there were with elsewhere within the region or the lead clinician. But as a result of working with us on developing the local care framework for Grampian, they came on board, they've employed an HD specialist, and clinics are now taking place in that area along with the lead clinician for Grampian. Similarly, in Lothian, when we were developing the framework, there was no lead clinician and there had not been for years. But shortly after developing the framework, we had a temporary lead clinician came into place, and then a permanent lead clinician came into place. In Ayrshire and Arran, we did have a lead clinician, but as a result of doing the work to develop the framework, that lead clinician's job plan was revisited. He was given an additional session to work with HD clients and HD families, and it was written into his contract so that in the event of him retiring, there was a long-term security for that role. And indeed, shortly afterwards, he did retire and has since been replaced. And this is another benefit of the framework. In Forth Valley, the HD clinical lead has been given some additional time, and we're currently in discussions about developing an HD specialist. At present, they have a neurology nurse who does hospital-based support for HD families, but we're looking to develop an HD specialist based on the framework which has been rolled out in that area. And another example would be Tayside, where they are working with us and are committed to provide a permanent and formal HD clinical lead, which they do not currently have. So these are some of the examples of things that have been achieved by developing the framework in itself over the years. And of course, we will seek to use it as a lobbying tool to ensure that further improvements can be brought forward as and when they are required. And I suppose a final point that I've listed there is the general visibility of HD, where as now we have a specific page on each NHS website throughout Scotland about HD and about the framework and about our local staff and about what can be done to help people, and that was not previously the case. So these are achievements that have followed from the development of the National Care Framework. So these things didn't happen overnight. They do require patience. They do require a lot of strategic thinking. And if you are thinking of following the model or something similar to the model, then this would be my suggestion to you, that you start from the bottom up. Start getting support from staff and family members. Start then from there, get a wide range of health and social care staff with whom they work to express support and get behind your work. Then move on to trusted intermediaries, and then think about opposition politicians who will then assist you to apply pressure on the government, and the government in due course will hopefully, if you do it properly and if you get the support that you need, they will endorse your framework, and that will be helpful to you as you seek to roll it out across your country. Start off with those health and social care providers that have got a strong HD service, and then move on to those perhaps less so, and in the end to those with no service at all. And as we've shown from previous slides, that those services are now in place. Where previously it was believed we would never have a service there, we do, because we have shown that the framework isn't impossible, which many claimed it would be, and isn't unrealistic and couldn't be implemented, as many claimed it wouldn't be. But by doing the work in that order, you prove that the framework can be done and it can work and it can be achieved, and it won't cost a fortune. If anything, it will save you money by reducing the number of crisis situations with which the healthcare system will have to deal with by putting the proactive support in place in advance. So that's really what I would advocate, that sort of approach. And I suppose it's a bit of a snowball effect. You start off with something small and it gets bigger and it gets bigger and it gets bigger, and it gets to the stage where those who felt they were opposed to it realise that they can't oppose it because it's proven to be so successful and so effective, and all the reasons they gave for it not working have been proven to be false. So I wish you every success if you wish to pursue that route. It's been beneficial to us. We believe it can be beneficial to people elsewhere, and we are happy to provide guidance and support by giving you the materials that we've used to develop the framework if it's something that you wish to do in your country. You can review the framework at care.hdscotland.org, and the site has been built to scale on whatever device you wish to use and works well on mobile phones, for example. Now, when you're looking at it, you may find that there are pieces of information that are out of date. There's web links that have changed. That's inevitable. And that was always understood as we developed the framework. So if you see them, let us know and we'll update them to ensure that the framework remains up to date. So thank you very much. I hope you understood my Irish accent. Possibly you did, possibly you didn't, I'm not sure. If you struggled, don't worry, here are my contact details. Get in touch with me and I'd be happy to help in any way possible. So thank you very much for your time. Thank you for listening, and I do hope that was of interest, and I wish you all the very best of success for what remains of your conference. Thank you very much indeed for your time.
Well, thank you so much to Alistair Hoare from Scotland for that truly encouraging and inspirational presentation of what's happening in Scotland, and some very interesting insights into the advocacy that made that comprehensive approach of support possible. And we may talk a little bit more about that after our presenters today during our discussion and question time.